So I don't know if people got the news today. Congress just put a middle finger up to everyone and left. We probably won't get a vote for a stimulus bill to after the elections.
Hey, like people are starving, you know?
So I want to.
Yeah, cool.
Yeah, people are starving. So why are people starving, Dr. V Dreams? That's because if you don't give money to small businesses to hire people to keep people employed, they can't, pay people, and those people can't buy food. So it's pretty much what's happening. So I want to
And
show.
you can't give money to small businesses if you've got no money and you've lost your job.
So pretty much, there's gonna be like if the stimulus doesn't pass, it's gonna be like a disaster of like low income, low small businesses who can't hire people, falling. Um, so pretty much, I mean, only 7% of small businesses. This is by Goldman Sachs. This is like the most like capitalist company in the universe, and even they're saying like, oh no, this is pretty bad. You guys should did something for these guys. Even though we're billionaires and don't really give a shit, but you should at least did something. Um, so this is a real disaster that's happening right now, on all different levels. I mean, the Republican Party tried to pass a really shitty kind of even shittier than the first bill, and the Democrats are not really putting in effort to fight, and there's nothing's happening now. So here we are.
I think they are putting in the effort to fight, which is why we have nothing. Remember that the Democrats don't hold the majority.
Yeah.
So it's possible that we will not see.
We have 4 seats. We take 4 seats. We can.
Well, I think it's 4 seats if Donald Trump is reelected, 3 seats if he's not reelected.
Yeah. So I want to play this next clip, Phil.
Blind Bat said Congress takes a lot of vacations, don't they?
Yeah. Yeah. Phil could play this next.
You know why? Because fuck the American people. That's why. They watched that pop copy skit from Chappelle's show.
So pretty much we have to worry about we're on our own. We got to figure out why do you have to take a COVID test? And testing is important, and this video pretty much talks about it. It's important to get tested.
Fulfill the most basic task in disease control: identifying the sick and separating them.
Wow, they jammed that shit all the way up into this noodle.
In the race to get a handle on the pandemic, a number of tests are now in use around the world. But how do they work? COVID-19 tests broadly fall into 2 main categories. Let's first take a look at the diagnostic tests. These check for an existing COVID-19 infection. Samples are taken from your respiratory system, usually a swab from deep inside your nose, and tested to see if they contain the virus. The most well-known one is a molecular test.
Yeah, COVID tests are not infecting people. They don't actually have the virus.
This generic material, or RNA,
they take
sample taken from your nose.
Yeah, they take a sample from you.
Yeah, that's what the video's saying.
Right.
The best time to do it is 6 to 8 days after infection.
Give more money to Jeff Bezos and evict me.
This sample might be falsely negative because there might not be
Yo,
virus
real life is too weird, man.
It's what's called the antigen test. This one looks for the proteins that are found on the surface of the virus, but it has shown to be less effective, as it often gives false negatives.
Oh, the antibody test. It's not really reliable tests, but they.
The second category of
tests something is better than nothing.
Also known as serology tests. These look for a past inactive.
So they're talking about it now.
Infection. What they're looking for are antibodies that are produced.
Yeah, Corin, don't fuck with it.
In response to
it ain't even worth it.
In order to protect you from getting the disease again. But these tests tend to be a bit tricky. False positives can happen.
And why do you think the false positives are happening? Because people were rushing it. These companies were forced to rush in the development of these things.
Coronaviruses, and can't look someone in the eye and tell them with a straight face that that was COVID-19, because there are some there can be false positives associated with the antibody test.
Also, it turns out that many people who've had prior infections get false negative results with the antibody test. This can happen for various reasons. First, it can take around 1 to 3 weeks for your body to make antibodies after you've been infected. And the volume of coronavirus antibodies drops sharply once the acute illness ends.
The goal is to really identify who is most likely to transmit this infection. Like, there's a lot of people that have recovered from COVID-19 that can go back to work. But the problem is their PCR test will still be positive.
You're right, Blind
Dr.
Bat.
Borgor says that what we need are saliva-based rapid tests, something that would resemble a pregnancy test.
We really need those. They're not really around yet.
Yeah, so the actual things that we need that don't even exist yet, which is crazy.
But we got the thing is, the federal government that we have was in such a rush to get votes that they have people developing and rushing to develop stuff that really wasn't all that effective.
Yeah,
imagine if you would have let them just do their thing on science's timeline and not on your political timeline. We would not be in this position right now. If Trump would have done his job instead of being a pathological liar, we would not be in this position right now.
Yeah, we could have gotten the process of like getting the proper testing, proper antibody tests all the way back in November. It could have happened all the way back then. They didn't even have to wait till February when he finally paid attention to it in the briefings. I mean, this is the situation we have for Trump. So this is why we're in this mess, and that's why I want to show this video. Why it's important to take a test. We just have someone in the Twitch who's actually going to see their mom, and they're going to take a test. This is why it's important. Shout out to them for taking a test, see it before they see their mom. It's so important you do that, So
people with cancer are already immunocompromised.
Yeah.
And the way that COVID-19, the SARS-CoV-2, because COVID-19 is the disease, the virus that causes the disease is SARS-CoV-2.
Yeah.
Like it does a lot of really foul shit to be able to replicate itself inside your body to get into the numbers that it is looking for that will allow it to allow your immune system to then react to it. Yes. So when they're talking about 1 to 3 weeks to develop antibodies, that is because the virus tries to trick your body into thinking that it's not being invaded in the first place.
Yeah, that's why.
So that's how you could get false negatives and false positives. Like it is a very, very tricky virus. Like I was just learning not too long ago about the different herpes viruses and how intelligent that they are. Yeah. I didn't know that people who've had chickenpox, like a lot of us, we have herpes. Because the chickenpox virus is a herpes virus.
It's herpes.
And the herpes virus is like way more intelligent than our immune systems, where they can hide inside your cells.
Yeah.
And anything that our body tries to do to try to counter the virus, it does something to suppress that, no matter what it is. Like these viruses, for whatever reason, are super, super smart. But then we got the fucking... we got these politicians saying, well, we need to have a vaccine before the election. Like, you don't know shit about how this works.
So I want to drop this next clip because like there's also a thing about contact tracing. And so let's say, well, a bunch of people get something at a giant event and you have to figure out who those people are. Unfortunately, we live in a country that uses our information to sell stuff and to follow us around like weirdos. So that's why people don't trust contact tracing. But I want to show this clip.
One constant in America, it's that people are always on the move. Whether it's walking, driving, or some other means of transport, we live in a mobile society. The pandemic tested that proposition when much of life ground to a halt back in March. How immobile did we become?
It's challenging because there are a lot of moving parts.
Jude Bayham of
shingles is no fucking joke.
Is a member of Colorado's COVID-19 modeling team. He spent this past spring studying how stay-at-home restrictions affected residents' travel patterns and coronavirus transmission. He used data from people's with location settings switched.
Trump's gonna hide it if you keep talking like that, yo.
Not identified.
By the time it gets to me, it's been aggregated. So your device is aggregated with hundreds or thousands of others.
He found that lockdown orders did indeed cause a dramatic increase in time spent at home.
I feel confident saying that reductions in mobility do relate to reductions in transmission, and not necessarily the other way around.
It's the kind of
staying at home. There you go.
Helps those in charge.
We got waffles in here talking about bleach enemas.
Are working.
So you make these policies, but you have no idea what the unintended consequences are of them. And so I think it provided some feedback to county health officials as to what are things on the ground.
Ryan Layer with the COVID-19 Mobility Network provided 3 counties with mobility data generated by Facebook, almost like a temperature check.
If we provide only to-go orders, how does that look? Okay, if you let people in stores, is that going to have are there going to be huge crowds, or does that just have an incremental increase.
Which is what he found. Mobility data is also part of an algorithm developed by a team at Harvard that uses Twitter activity and Google searches to try to predict virus outbreaks 2 weeks in advance. Cell phones already track the movement of people between states. Researchers caution they're still not sure how representative the information is that they're getting. City dwellers act differently than those in the countryside. But as governments become more data-driven, mobility data could be an important tool going forward.
You're not going to learn everything from mobility data, but I think it's
so people need to learn that term, mobility data, for 2021, please.
Bayham, who also studies the
especially when you start tracking people who are dissidents who speak out against the government.
Same way, data could be an important means of containment.
So there you go, mobility data, a new data. So like this is crazy right now. So the fact that they're able to get that information without anyone knowing, without you knowing that someone's looking at information, that's what pretty much.
We're going. We're going from Big Brother to Funny Uncle, real fucking fast.
Yeah, I mean, and the coronavirus in some ways is gonna accelerate it. It's accelerating it because they want. we already have option on iPhones for COVID tracking, so it's already there and it's waiting to turn that switch on. So that's the horrible dystopic news. So we're gonna go to Fight Club.